Hi, and welcome back to my channel. We're talking today about Dapsone, a fairly new antibiotic that has been used over about the past decade to treat Lyme disease. I've been getting asked more and more about this in my clinical practice. For those of you that do not know me, my name is Dr. Diane Mueller. I am a Lyme literate doctor, and I've seen some of the dark side of Dapsone in my clinical practice. I've only had a few people that have come into my practice and use it, but it has definitely made me very nervous about it because I've seen people that just had a really hard time with relapsing it. Some studies have shown that only about half of people after using this therapy remain in remission 1 year after use. So while this drug does claim to get to those persister and dormant cells of Lyme, I have serious concerns about its capacity to do this because of the number of cases of remission that are actually reported in studies with use of this antibiotic. I am still a huge fan of Cryptolepis for the resistant forms of Lyme, as I have seen this particular herb do so much better than drugs on the market, and it actually outperforms drugs for those persistent, dormant forms of Lyme, even when it comes to research. So because of that, I think we need to use any of our antibiotics very cautiously, because Dapsone continues to be and continues to show the similar results that a lot of our Lyme antibiotics do, which is just not consistency over time when it comes to actually being able to get at those persister or long-form dormant cells. If you are interested in learning more about Lyme disease, please always make sure you go take my quiz at getwellquiz.com. In my quiz, I do talk about various other infections and toxins and other types of disease processes that coexist with Lyme, because one of the things that I have most frequently seen in my practice is when people get a Lyme diagnosis, all of the treatment is really oriented to attacking Lyme, which is important, but much of the time it is Lyme and many other root causes. And it's super common that when people get diagnosed with Lyme, everybody just starts treating Lyme and nobody is looking for all the other root causes, plus the damage of the microorganism. I hope this has been helpful. Please do subscribe to my channel so you don't miss when I put out new content, and please go take that quiz so you can get additional insight as to what could be going on with you. That's totally for free at getwellquiz.com.